sharing. And then I think it is now almost time. I would want to take the opportunity to welcome all of us who have joined, and also those who are in the course of joining. But we already make a quorum. It's exactly time for us to start. So I will hand over to my colleague, Anafi, to lead this. Remind you that our traditional LabCoP session is also coming on. It has already been sent, but this is one, the baby born out of LabCoP, and we are happy to see all of you coming. So thanks for the team at the International Lab Branch for steering this, and we are happy to be part of. We are happy to be part of this. So I hand over to you, Anafi, to take us on. Anafi.
Can you hear me?
Yes, we hear you
Hello?
now.
Yes. Hello? Yes. Subject matter expert, David Bresler from the ILB. We are happy to have him. We looked at some introductory material last week, mainly looking at what countries had actually responded to the given survey. So we are now getting deeper and deeper into the meat of the subject, and what a good way of starting by looking at what the normative body, the WHO, the World Health Organization, has said in terms of waste management. Without taking much, I would like to hand over to David.
Okay, David.
Which will be about 20
okay.
to about 25 minutes, followed by a.
Yeah.
If we could pull up the presentation and you could turn it over to me, that would be appreciated, and we can get started.
Yeah, you already have the presentation on your. You just share the screen.
Oh, okay.
Mm.
Okay, where is it?
I'm not seeing it.
Yeah, I don't see it.
No, it's
You
not.
see that orange green sign pointing
yeah.
up, share.
Right.
Yeah, just click on that one when you have your, yes.
Yes, starting.
Okay, so I need to bring up, oh, okay, I got you. Never mind.
What is it?
I need to, let me see.
I don't see the presentation there.
Did I sent you it last night? So,
I know I have it up on this computer.
okay, but we,
you,
yeah, okay, hang on then.
can you?
I should be able to bring it up here. Sorry about that. It's just a little bit of,
I see it. Just from your computer. Okay.
Yeah, we can see your screen. So I think the moment you open the presentation.
That's not it. Let's try this one. This one should be, yeah, there it is.
Yeah, okay. I can do it from here. This
All
one,
right.
this one doesn't have.
Okay.
Okay.
Hopefully in a few seconds we'll be able to do it here.
Okay, we are there.
Right.
Camera, there's no
All right.
camera on that one.
Okay, can everybody see the screen then? Can everybody see the presentation?
Yeah.
Okay,
Yes.
great. Well, welcome everybody again to the second session of this short-term training. And again, this is a LabCoP session on healthcare, laboratory and healthcare waste management. It is the second session, and during this session, in the next 25 or so minutes, we'll be covering the WHO official guidance on healthcare waste. And the guidance is actually entitled Safe Management of Waste from Healthcare Activities. So again, this is a collaborative short-term training effort conducted by CDC ILB, and I am David Bressler, along with the African Society for Laboratory Medicine and a Global Fund. So the purpose of the training, purpose of the overall 6-month training, we started in April. It is really to support the LabCoP that focuses on the scale-up of routine HIV viral load testing and monitoring. We are speaking during these training sessions specifically to the growing waste management issues of viral load testing, solid and liquid waste that comes from that diagnostic testing. And the purpose really is to bring together all the country teams and experts that are involved in waste management to identify strategies and methods for dealing with it in country. What we want to give you are tools and ideas and information for building and sustaining waste management systems and awareness. So here is the outline for this session. We will review HIV viral load waste disposal issues, the products that come out of it, why we consider this to be an important thing. We will then take a look in depth at the various chapters of the WHO guidance, Safe Management of Waste from Healthcare Activities. We'll talk about some of the potential remediation technologies and considerations for endpoint waste management. Basically, getting rid of the waste that you produced. And this means endpoint, it means the final solution, really. We will then talk about some high-level next step recommendations that we sort of look at and maybe would pass on to you guys for consideration as well. Okay, so here is what we're going to be talking about, viral load testing, waste management overview. And obviously we are talking about the scale up of viral load testing. And we expect by next year, more than 30 million HIV viral load tests will be performed across the world. We consider that this is something that needs to be dealt with because of the potentially hazardous chemical waste that comes out of the diagnostic process. What the reagents that are used by the platforms in general all contain guanidinium isothiocyanate or guanidinium thiocyanate, and you abbreviate this GITC or GTC. One of the issues is that GTC can produce hydrogen cyanide gas or cyanide gas when it comes in contact with some sort of an acid or an oxidizer such as bleach. So why is that important? Well, how do we neutralize a lot of the infectious waste that we produce in medical laboratories? We often use bleach as a decontaminant. So if it's producing cyanide as a byproduct, we probably want to avoid that as much as possible. So it's important to find out how much is in it and whether it actually is a toxic component that comes out in the waste or not. We believe that thiocyanate is toxic to humans and animals, and if it goes down the drain untreated, it can produce the waters and harm aquatic life. It can lead to public health threats for not only our generation, but if it gets into the water supply, potentially the next generations to come. So here's a little bit of a graph that sort of goes through a listing of what we typically use for testing platforms. You can see that, and this really is discussing the waste generated from viral load and EID testing platforms and the manufacturer's disposal recommendations. So on the left-hand side, you can see that we're talking about the Roche, the 3 Roche systems, the Abbott system, Biomuria produces another system, and obviously GeneXpert. All of those, if you look down there, I've highlighted that all of them contain, to a certain extent, in certain quantity, 5%, anywhere from 5 to 0.9%, 50 to 60% in many cases. And we're looking at specifically the guanidinium isothiocyanate component here. The one that we do not see as having the guanidinium would be the ALARQ, most often used for point of care. And so whether that is an issue as far as guanidinium goes, we don't know, but certainly there would be solid waste produced out of that as well. So if you look to the right, you can see that the manufacturer's recommendations for liquid waste disposal are, in general, do not mix reagents or liquid waste with bleach. And it goes down the line. Biomuria actually includes a little bit deeper sentences. It says, avoid release to the environment, dispose in accordance with all applicable regulations. Follow label warnings even when reagent containers are empty, as there is potential retention of product residue. It is the user's responsibility to ensure safe handling conditions, storage, and disposal. And the GeneXpert talks about the test cartridges, etc. And it also says, do not mix test cartridges or sample reagent vials with bleach. So everyone is concerned a little bit with the potential for the cyanide release once you mix the reagent GITC with bleach. So all in all, most of the manufacturers contain at least some percentage of guanidinium isothiocyanate in the reagents and in potentially the waste. And you can also see that the manufacturer's recommendations for disposal aren't very detailed. And obviously what we want to avoid is it pouring down the sink. That was one of the things that we found on the survey, was that most people have no other choice but to pour the waste down the sink. We want to try to avoid that and give you some information and resources to avoid it. There are potential methods for liquid waste disposal on the far right side, and we'll talk about those a little bit later. So on to the Bluebook. This is the official guidance document for all kinds of healthcare related waste and best practices. There are 15 chapters, basically going from the introduction to what they're trying to do with this guidance. Goes through the definitions and the types of waste that you would typically associate with healthcare related waste, and it goes through talking about how to minimize it, how to reuse it, recycle. It covers regulatory and policy issues, talks about how to store waste and how to transport it. Treatment and disposal considerations, we'll cover that more in depth later. Talks about sewage and wastewater, as well as the economic considerations for healthcare waste management. It talks about how you should consider training your healthcare and hospital personnel. And it also gives a very detailed coverage of the training and educational issues that you need to consider. There's also a forward-looking chapter on healthcare waste management in emergencies, such as during outbreaks or periods of war. And it goes, the last chapter is future considerations for healthcare waste management. Oops. Hang on, we're having a little bit of a, okay, let's see. Yeah, okay. So just to cover the first, the introduction first, basically what WHO is recognizing is that healthcare waste management is fundamental for the provision of quality people-centered care and protecting the patient and staff safety, as well as safeguarding the environment. They recognize that if it doesn't look like you can handle your hospital and healthcare waste, then people look at it as public perception issue and basically equalize that with poor standards of health care. And so nobody wants to be in that situation where it looks like we can't deal with our healthcare waste. And this, the Bluebook is trying to give ways to handle it better. The Bluebook is designed to be a source of impartial healthcare information and guidance. And whenever they conceived the Bluebook, it was basically to give medical staff, healthcare facility directors, the auxiliary healthcare workers, infection control officers, waste workers, regulators, policymakers, anyone that could have some sort of interaction with healthcare related waste. Now, one of the things that got pointed out was they sort of missed the laboratory folks here at this point. So we added that in a little bit later on. Okay, so chapter 2 covers the definition and the characterization of healthcare waste. Basically, healthcare waste includes all the waste generated within healthcare facility, research center, or laboratories related to the medical procedures. So basically, anything that comes out of a hospital, a laboratory, care unit, whatever, emergency room, that sort of thing. One of the things, the Bluebook is very helpful in providing a lot of different forms and tables which can help the facility figure out where and what they're dealing with. And one of those examples is that the daily healthcare waste data collection form. This is table 2.4, and I just extracted that and put it there as an example. The Bluebook is filled with all kinds of tables and useful data collection forms, and this is just one of them. It can help you get at your own facility, get an idea of the types of waste that are coming out of your laboratory facility or healthcare facility, how much weight, what type of waste it is, and then you can figure out the volume and put in whatever notes. It may be that one department produces most of the waste at your facility. And so having that information, being able to collect it, is an important thing. Okay, so chapter 2 goes into the definition and characterization of healthcare waste. And we spent a little bit of time on this during the last session. Basically what we're talking about is infectious waste, pharmaceutical waste, pathological waste, cytotoxic waste, sharps waste, radioactive waste, chemical waste, as well as what 85% of the waste that comes out of a healthcare facility is. It's non-hazardous or general waste. And so most of the book is focused on all of the other types of things that really do pose a hazard. One of the things that we find is that we don't really do a good job of educating people, the workers in healthcare facilities, as to how to segregate their waste. So we find that, we'll find sharps in a general waste container, or we'll find the infectious waste in something else other than an infectious waste container. This can be a serious issue, and it leads to a lot of wasting of the resources that you have. It leads to time down for certain things. It may result in someone getting infected by by stabbing themselves with a sharp that they weren't expecting to find in a general waste container. So training and awareness of proper waste segregation can really reduce cost and save resources. And so that's one of the biggest things that I think the Blue Book points out, that we can really save a lot of the resources, a lot of time and effort by just knowing how to properly segregate the waste that's coming out of our healthcare facility. Okay, so chapter 3 goes over the risks that would be associated with the waste coming out of your facility. What are the hazards that would be associated with this? And it spends a lot of time, and I'm not going to go through them because most of us really do know what we're talking about when we're talking about waste. We'd be talking about the infectious agents that may be worked with as part of our job. It may be the infectious agents that are coming out of the hospital ward. We can be talking about genotoxic or cytotoxic chemical compositions from cancer treatments and things like that. Presence of toxic or hazardous chemicals or biologically aggressive pharmaceuticals. Now, this toxic or hazardous chemicals is something that we would normally be looking at for the viral load waste. Radioactivity has been sharply reduced in most cases. Most of us don't use radioactive materials all that much, and so that has been cut way down, but in some cases we still do need to consider that as an issue. And obviously one of the biggest things is use sharps, things like scalpels, needles, broken glass that may be contaminated. So who may be at risk in handling this? Obviously, we'd be talking about the MDs, the doctors, the nurses, healthcare auxiliary people, the hospital maintenance staff. And we wanted to add in here laboratory personnel specifically, because that's probably what most of us are going to be dealing with. Patients in healthcare facilities, or those folks that may be receiving home care. Visitors to healthcare facilities, workers in support services such as the cleaning people, people who work in the laundry room and things like that. The folks that transport waste to a treatment or disposal facility. Workers in waste management facilities, and that includes those people that work at the landfill or the treatment plants. And they also included those people that are the informal waste collectors that we often see as well. They call them informal recyclers, and some people might refer to them as scavengers that go through the dumps looking for things that can be used. And so we may be endangering those people as well, and that can add to the public health burden. And overall, what WHO wants to get across is that it also can endanger the general public. So those are the issues that are associated with poor management of healthcare waste, and what we're trying to do is deal with that. So one of the biggest aspects, and something we will probably spend a little bit more time with as we go through the trainings, are the legislative, regulatory, and policy aspects. WHO recognizes that an active government intervention really is needed to have an impact widely across a country or a nation. And developing that national policy really serves as a starting point and the blueprint to drive the decision making at a national level and allow the mobilization of resources and efforts to make true change, make real changes. National policy should take into account the needs and the situations in the country, as well as any sort of international agreements or conventions that govern public health. The WHO Blue Book takes these into account, and throughout the book it mentions the Basel Agreement and many of other of the conventions that have looked at waste management. It looks at sustainable development and keeping the environment protected and in ways that you deal with the waste management. We will be covering, as I mentioned, the legislative and ways to deal with regulations and maybe put them in place at a national level or get them started. We'll cover that in a later session during the next couple months. Again, Chapter 5 goes into this a little bit more specifically at the national and the facility level. So getting policies changed or making people at your facility aware of national policies. They consider that important enough subject to spend another chapter on. Chapter 6 deals with healthcare waste minimization, reuse, and recycling. And this really takes into account waste management hierarchy. And we'll spend a little bit of time on that, but really it's discussing how you minimize producing waste in the first place. Maybe that's getting syringe bodies made out of the same type of plastic so that a country can utilize more of that same plastic and spend less time with different ways of disposing different types of plastic. So they also go into the safe reuse of medical waste, as well as recycling and how to recover waste energy from the processes that are involved in that. Chapter 7 talks again about segregation, the storage and the transport of healthcare waste, developing segregation systems and what the hazard symbols are, making sure that personnel are trained in recognizing those symbols and recognizing how to dispose of the waste at their facility. It gives data on what the specifications for waste containers are. It also talks about transporting waste within your facility as well as transporting it off-site, and then obviously storing it for short term and long term. Chapter 8 covers treatment and disposal methods, and this is selection of the final treatment method. And I told you that we would cover that in a later slide during this session, so we'll talk about that a little bit later. Collection and disposal of wastewater. It goes into sewerage considerations, what the issues are for wastewater, and if healthcare waste gets into that and pollutes it. Untreated wastewater can result in waterborne diseases as well as big environmental concerns, can also pollute the drinking water resources for the nation. How to deal with wastewater collection and disposal is something that Chapter 9 deals with. One of the things that comes up when we're trying to make people aware of waste management and properly doing waste management is how much does it cost? Figuring out what the economics of true management is. And the WHO Chapter 10 goes into this in depth, and it gives you various tools for estimating your management costs, ways to treat it, figuring out what the pricing models are for treatment providers, contacting people that can do waste management, your contractors. And it also goes into making recommendations for how you reduce costs in the first place. So there's a lot of good information in Chapter 10, and that information can be used to make your management aware of proper healthcare waste disposal. Chapter 11 deals with the health and safety practices for healthcare personnel and waste workers. It talks about informing and training your waste workers in how to identify hazards. It gives recommendations for exposure prevention and control. It lists some of the issues for personal protective equipment. It even gives examples of what types of personal protective equipment that these workers should be wearing or trained on at least. And also goes into establish an occupational health and safety program at the facility, talking about if a person gets exposed, what can be done with it. And also surveillance, making sure that the people that are working with healthcare waste are kept safe and kept protected, and just managing their health is a very important thing, as we all know. So this sort of just goes over, it's sort of a little bit of an aside, but it talks about exposure prevention using the hierarchy of controls. And WHO spends a little bit of time on this, and I just put this slide in there here as a way to explain what it is we're trying to do, and that PPE, just because you're wearing PPE, does not mean that you're controlling everything that you can, especially if people aren't trained in how to use it. But the hierarchy of controls basically goes from the most effective solution or method of control to the least effective. And so obviously the most effective way to eliminate, to deal with a situation is to completely remove the hazard. That's the best way to do it. Now, most of the time you can't completely eliminate the hazard. And so what we try to do then, if we can, is we try and substitute a less toxic or a less hazardous way of doing things. Many cases we can't do that either. And so we come up with engineering and administrative controls or work practice controls. Basically, the engineering controls isolate or remove the hazard. We think about biosafety cabinets as an engineering control to take away the infectious aerosols. In many cases, what we use engineering controls would be that we move waste in specific containers. So that would be an engineering control. Controls or isolates the hazard. The administrative controls are really the policies that you as a facility put into place to limit exposure to a hazard. Work practice controls really control or reduce exposure to occupational hazards through modification of behavior. And the last thing that we want to rely on really is PPE. And these are just the barriers between the worker and the hazard. So you break that barrier, you end up possibly with an infection. So personal protective equipment is the least effective, and you should really strive to use all of these types of controls to prevent the situation in the first place. Okay, chapter 12 goes over hospital hygiene and infection control. Talks about the source of infection and routes of transmission. Talks about cleaning, sterilization, and disinfection materials, characteristics of the disinfectants that you use or may want to consider using. Talks about standard precautions and also how to develop and enforce hand washing protocols. Chapter 13 talks about training, education, and public awareness. This is what we're specifically trying to do here during these training sessions, is raise the awareness of health and safety and environmental issues relating to healthcare waste, and specifically viral load waste. Chapter 13 goes into training examples, the who, what, when, where, and how to plan training and develop resources for doing it. Chapter 14 covers healthcare waste management during emergencies. And as I mentioned, this would be considerations for dealing with the waste during outbreaks, natural disasters, and in some kinds of conflicts within a country. They give rapid assessment and emergency response considerations and ways to develop simple action plans and put those into place. Okay, so in-depth considerations, Chapter 8, returning to Chapter 8, treatment and disposal methods. So what we're talking about is the ultimate way to get rid of the waste. And these are often very expensive ways to do it. But and one thing I do have a little bit of an issue is how they broke the chapter down. So if you read through it, and I would encourage you going to the Bluebook and reading through some of the sections that we're talking about to get a better understanding. But it talks about treatments for infectious waste first, and then it goes into the overall hazardous waste treatment methods. So obviously, when we're talking about for infectious waste, we can destroy the infectious organisms through thermal methods, autoclaving, steam, heat. We can use chemical methods. We can use irradiation. Chemical methods would be obviously things like bleach or other disinfectants. We can use irradiation, not very commonly used, but we do use it. biological methods, using another organism to clean up the waste. And we can be talking about mechanical methods, basically shredding materials so that they no longer pose a hazard. So the overall hazardous waste treatments methods are things like the ultimate disposal. These are the endpoint considerations, the endpoint remediation technologies. And here we're talking about high temperature incineration. Things like that are used at cement plants or rotary kilns. And this is where the temperatures have to reach approximately 1100 degrees Celsius. These types of plants are very expensive to build and to maintain, but they can also recover energy from dealing with that. Encapsulation and landfill is another expensive treatment method. It requires the land to put the waste into. And then what we're talking about is encapsulating the waste in containers, and usually you're encapsulating it in cement or something like that, and then you're monitoring whether there's any sort of leakage or anything like that. So those are probably the most well-known technologies we're talking about for ultimate endpoint disposal. I mentioned about I wanted to give a little bit of the next steps that we're considering here, but also things that your own countries can look at for next steps. One of which is determine accurate chemical composition of the effluent that comes out of your viral load waste testing platforms. We're trying to work on that here at ILB. It may take a little while to get an accurate chemical composition, but we think that that's one of the keys to, number one, determining whether this is the big problem that we think it is, and then once we know that, we can determine methods of neutralizing it as well. Determine the concentration, obviously, of the GTC that's able to be safely disposed of, and let's see, and how you would do that, and in what volumes. We're trying to investigate what practical technologies are available for the waste disposal of these chemical compounds and other things that would be associated with viral load waste. We want to encourage manufacturers to determine if there are safer, more practical, and more sustainable alternatives to GITC that they use as a chaotropic agent in their viral load diagnostic tests. And one of the things that we probably should suggest is that a white paper be developed on the practical viral load waste disposal methods. And again, these are things that we're looking at and things that maybe we'd like to share with you and be able to get you involved in that. General guiding principles taken from the WHO manual: understand what the hazards are to your healthcare workers. They may be biological, chemical, the disinfectants, they may be sharp injuries or lifting heavy loads. Implement, we want to make sure that you implement and enforce the standard waste management practices, which are proper collection, segregation, transport, and disposal. Implement the exposure prevention and control plans that you develop. And these should deal with how you would clean up spills properly, how you would report accidents and incidents, use of effective PPE, and developing a post-exposure prophylaxis policy and procedures, as well as consideration of immunizations. We also want to make sure that all your workers are trained on the potential hazards of waste and the general biosafety practices and procedures. I've included the link to the WHO publication that we just discussed. I've also included a link to the, it's really a summary. WHO considered that the Bluebook publication was of such importance that they put out in 2017 a summary of the whole document. So if you don't have time to read through the entire Bluebook, take a look at the summary as well. And I think something that we included from last time, resources for low and middle income country in dealing with waste issues. With that, And I know I've probably gone over by some minutes, but with that, that finishes up the presentation. Do I need to turn it back over? Or
Thank you, David. You could leave it there.
okay.
Yes. Can you hear me?
Yeah.
Hello?
Very stable. Yes.
Yes. Sorry, my connection is a bit unstable, so I was just making sure you can hear me. Thank you very much, David, for.
Okay. It seems your network is not very good.
Presentation. I would like to.
Yeah.
Charles, we're having a little bit of trouble hearing.
Yeah. Okay. So I think I can assist the next session. Yeah. Is everybody able to hear me?
Now we are.
Yes.
Okay. Thank you very much, Dave, for that insightful presentation. And I know it must have generated a lot of interest from the audience. We've been capturing questions that have been coming through the chat. I will ask Nicholas, who has been monitoring the chat, to read the questions, and then the presenter responds, and maybe the rest of us also.
Okay, thank you very much. There are several questions in the chat. I'll read one by one so that they may be answered systematically. And the first one is from Yeld, and he is saying, Hologic is not mentioned in the GTC containing testing platforms. Is it an overlook? I think he's referring to the testing platform called Hologic Panther, that you've not mentioned it among the platforms that produce GTC. So he's asking whether it is an overlook.
Oh, well, so what we did was we just kind of looked at some of the platforms that we would use, and we may not have gotten all of them. It may be an oversight, but we didn't want to go out there and look for every single thing that's out there right now. There's still a lot of manufacturers getting into the business of doing that. Basically, what we wanted to do is point out that most of the manufacturers continue to use as their Caetro GTC or GITC in that. It's not a, and we believe that Hologic does as well. I can't specifically say because I don't know about that platform in particular, but basically what we wanted to show was most of the manufacturers do continue to use guanidinium isothiocyanate in their platform material reagents.
And Hologic does. So it would be the same principles. That's fine.
Okay, read other questions.
Okay, the other question is from Tsime, and is asking, can you break down specifically which particular reagent contains GITC? Can you break down specifically which particular reagent contains GITC? And then she makes a comment, as we struggle with numbers of LFA waste generated, in the lab, can we get the manufacturers to revise the protocols and come up with none or less toxic components? We all know proper handling of waste generated. We all know proper handling of lab-generated waste is always going to be a challenge in poor resource countries. So that's from Tsime.
Okay, so basically, what we're trying to do is work with the manufacturers. Some manufacturers being very open and willing to work with us. Some of them need a little persuasion to work with trying to come to a solution on this. And obviously we have to keep in mind the manufacturer's reason for being too. And so we need to make it economically feasible for them to develop new methods, less hazardous methods than GITC, and it's been done before. I think that if you take a look at what was done with lithium bromide many years ago, 20 years ago, lithium bromide was a big issue, and it's considered to be a carcinogen, a genotoxic molecule, and there was a lot of effort to figure out ways to deal with that specific waste. And as we may know, there have been some good advances in utilizing different fluorescent markers and things like that. Cyber green, cyber red were developed in specific response to the hazards of the lithium bromide. And even now we figured out ways that we can treat the waste and keep it to a low level. So these are the types of things that we're going to try to work with the manufacturers on. It's just a matter of getting them to the table and making it worth their while. And I you know, it's sort of hard to, these are broad questions that we've got to deal with and discuss. So hopefully that answered a little bit of the question.
Okay.
Another one?
The other question is from Jean Baptiste and is asking, could genotoxic, cytotoxic, and radioactive wastes be disposed of with other highly infectious wastes, or they require their own waste bins? The question is, could genotoxic, cytotoxic, and radioactive wastes be disposed of with other highly infectious wastes, or they require their own waste bins?
So the question basically is, can you dispose of mixed waste, which is what biological or infectious waste, along with hazardous chemical mixed in, and radioactive mixed in, and genotoxic chemicals mixed in, can they be disposed of all in the same place? It depends. For radioactive, you're talking about a highly specific issue, and it's a good thing that we're starting to actually deal with the radioactive material by using less and less of it. But things like the chemical waste mixed in with infectious material, you have to take care of the infectious material first, because that represents the biggest danger to anyone handling it. And so basically you want to neutralize the infectious material first, and then you consider the issues of the chemicals that are in the waste after that. So it's important to get rid of to neutralize the infectious material that's in the waste first, and then you have to make the considerations for dealing with the genotoxic or the cytotoxic or other chemicals or radioactivity within that waste material. And it is a complicated subject to deal with that. So, but the bottom line is it should not go into the same container especially until the materials have been neutralized. It may be that you have to put the infectious waste into the infectious waste container, but later on, once the infectious waste has been taken care of, either through sterilization, heat autoclaving, or whatever, then you're going to have to deal with the other materials. That was a long-winded answer, but.
Okay, yeah, then we have comments, people requesting the presentation to be shared, which will be shared. And then the other question is from Dave Muthama. He is asking, what happens to GITC at those high temperatures? What happens to GITC at those high temperatures?
So one of the things with and actually let me see if I can back up here a little bit. I may or may not be able to. Well, let me do one thing in order to just pull up that slide for discussion. So the high temperature incineration, basically what we're talking about is taking the waste to a high enough temperature that all of the organic materials, all of the paper waste, all of the infectious waste, all of the chemicals that may be in that waste, including disinfectants, including the heavy metals, whatever, are reduced either to their complete inorganic substances, basically carbon, hydrogen, nitrogen, oxygen. That and whatever solid waste remains is what we're talking about. So the high temperature incineration will reduce the chemical molecules like guanidinium isocyanate to carbon, nitrogen, oxygen, and hydrogen. And so the only thing you're left is the solid waste, the ash material, and that may contain some heavy metals and things like that. And so even the waste that comes from the high temperature incineration, that ash that remains needs to be dealt with in some way safely. But it does reduce all of the volume of the waste. It's just that it's sort of an expensive process to build and maintain.
Okay, the other question from Sime is she's asking, is that Bluebook the presenter keeps referring to free online? Is that Bluebook that you've been referring to accessible online at no charge?
Yeah, it is available online at no charge. And I provided those links at the end of the presentation. You can go right on there. I think you can click the link. If you can't click the link from the presentation, just copy it into your browser.
Okay. Then we have a comment from someone. It's the informatics support. They are saying, I suggest David can put the PowerPoint on the biosafety website. This way, anyone can go there and download it. I think that one we shall discuss. Then the other question from Ndugwani is saying, it seems GITC is the common toxic material that is found in the HIV viral reagents. Could there be any other chemicals which could be hazardous to humans and animals? Repeating the question, it seems GITC is the common toxic material that is found in the HIV viral reagents. Could there be any other chemicals which could be hazardous to humans and animals?
Okay, so the two questions were, can we post these links to the biosafety website? And I believe that we can. Right now, ILB is developing a biosafety website that we hope to offer resources and trainings and things like that on it. We're in the process of standing that up right now, and it may be at least a couple of weeks or so before that will go live. But yes, the intent is that we will post all of these resources in some form of fashion that are easily available, and it'll tell you where to go for that information.
We can give this to ASLM.
And we can also give it to ASLM to post it on the website as well.
Yes.
The second question involved whether there is an alternative chemical to GITC. And as I mentioned, GITC is basically used as the chaetrope material, the chemical that disrupts the viral membrane so you can get the DNA or the RNA out of the virus. And so it pulls the DNA and RNA out, and it stabilizes it, but it breaks up the cell membranes and the viral membranes and allows that to happen. I don't know. I'm not a chemist and I'm not a biochemist, so I suppose that there are probably other ways or biochemical methods for doing it. It's right now that the manufacturers have settled on GITC because right now it's considered to be the best way of doing that. And again, I am not a biochemist, so I don't know what the alternatives out there are. There probably are alternatives. It may be that it costs a little more. Hopefully those items would be a little safer to use for the environment, or maybe the material gets used up completely during the reaction in the platform, and that way you don't have any coming out in the waste. These are all considerations, but these are considerations for the manufacturers. like I say, 15, 20 years ago, we were able to do that with the ethidium bromide issue. Hopefully there is some sort of strategy or some sort of solution for GITC as well.
Okay. Is there another question?
No, I think the rest were comments. The rest were comments, yeah.
Okay. I think this has been an eye-opener, but like, you know, people get stuck with all this information, and yet they are going in maybe the next day or even the next hour to go back and do what they have been doing, which is not a standard way to get things done, especially like the liquid waste which has been draining through the sink. What would be your practical guidance that you would give the scientists on this call who probably are going for the next shift to actually generate the same kind of waste, draining it through the sink? What are some of the practical recommendations that you can give them moving forward, beginning from the next moment after now? What they can do, you know, to try, they may not solve the problem completely, but not to continue building on the problem, but start being part of the solution or looking for a solution.
I think that what I would recommend is that they take a look at the Bluebook, go through the Bluebook and make sure that the people that we have on the call are the appropriate people that are dealing with or interested in or have some sort of part in dealing with the healthcare waste management issue that we've just discussed. But the important part is to look through that Bluebook, look at the alternatives, look at the solutions that WHO is giving. Because one of the things that we mentioned is that solution to the GITC problem as well as overall waste management won't occur without the country involvement. And that means the people at the levels that deal with this in the facility or in the nation that deal with these problems on a day-to-day basis. Unless we can get their involvement and their willingness to be knowledgeable and to share that knowledge with their higher headquarters, with the people up above them, with their national leaders, with their facility leaders, with everyone that they can think of. In this way, we can start moving things forward a little bit, developing the awareness, developing the political will in the country to consider that these are serious issues that we need to talk about and need to discuss. And I think Shirley may have some additional things that we can talk about as well. Just a few points.
So last month, we asked if countries wanted specific technical assistance on this issue to help move the needle, to let us know. And we noticed that there are there's a very broad audience that showed up, which means that we have a lot of interest. We heard back, really got feedback only from one country. So since there are many of you on the phone, we wanted to know if you all could speak up and say if there are specific countries on the line now that would like to CDC to partner with them to help advance the needle. That's one question. And then also I wanted to know of those who are on the phone, which countries either have policies or are working on policies specifically to deal with the viral load waste issue. Over the next month, we're going to be, Dave is leading that effort, developing a one-pager specifically for viral load waste management in consultation with our partners, and that will be shared on the next call. So that said, that we're going to put out some general guidance that we think that would be valuable to countries, but we'd like to hear from you all related to which countries are actually working on this issue and whether you would like specific support.
Okay, thank you very much. I think this is very timely, seeing that we are urging countries to scale up viral load, but as they scale up viral load, they are also scaling up waste. And there's no opportune moment to address this. And thanks to ILB for bringing up this to the forefront of the discussion that we are having at this moment. And we look forward to the next training session. As they have already informed us, let us go and look for this Bluebook, read the book, and then when we come for the next session, we'll be more informed. We'll be asking more objective questions and maybe being part of providing some of the solutions after we internalize the guidance that is given out there. So
Charles, so we
yes.
were asking now, we have a couple of minutes, or maybe actually now we are at the top of the hour, so we're out of time, but we wanted to give 5 minutes for opportunity for countries to speak up and say if they would like specific technical assistance and which countries on the phone are actually working on this issue, just so that the whole group could be aware. If we could just spend a minute letting them respond.
Okay.
Let's see whether we get any responses.
Yeah. So if there is a country that feels they would want, I would imagine every country would want technical assistance.
Someone wants to say something.
Let me go from Kenya.
Yeah.
This is Dave from Kenya.
Mm.
So far, the central labs, many of the central labs in Kenya have ways of incineration, which use the high temperature option. But then for the point of care facilities, laboratories out there across the rural areas, they basically been storing the cartridges from the viral load testing and waiting to see if there is a solution in the near future. The other thing that has been suggested in country is that we can work together with the cement factories to be able to help us in incineration where that is possible. And Kenya is very much interested in working together with CDC in rolling out this support in our country.
Thank you. Are there any other, thank you. And Anafi, you have his email to connect us. Are there any other countries that could speak up? Thank you, Kenya.
Yes, in Eswatini, we are piloting the GeneXpect in Eswatini, and we've heard issues on how we can. Hello?
Yes. Go ahead.
Yes, I was talking about Eswatini. We are piloting the GeneXpect in a month's time, and we've had challenges on how we can dispose the cartridges. And we've been working with the local maintenance company, which is maintaining the incinerators, trying to make sure that they reach the optimal temperatures. We don't really have much of documentation in place, and I think getting guidance from ASLM and CDC will be very helpful.
Thank you, Eswatini. We will definitely be in touch. Are there any other countries that would like to speak up?
Hello.
Yes.
This is Stuart from Zimbabwe. We are working on waste management in healthcare facilities. So recently we were conducted by National Microbioreference Lab, saying they have more than 2,000 liters of waste that contain cyanide. So it also came as a very greater concern to us as a private company working on waste management, to see ways in which we can dispose this liquid waste. So we don't have a plan at the moment.
Zimbabwe, it's kind of hard to hear you.
Yeah, but me, I've heard. Okay. Yes, they are saying recently they got to be alerted, I think from one of the labs, that they have like over 2,000 liters of waste that contains cyanide, and they are grappling with a way to manage or to handle this. So it looks like, I would imagine, I think the International Laboratory Branch just needs to get ready to support all countries. To provide technical assistance to all countries. I'm seeing Arwin from Malawi. He must be really wanting to say something about Malawi. What are you saying?
Yes, exactly. I wanted to say that in Malawi, we're in the process of developing the protocols of disposing this kind of waste. So we feel like if we have a technical assistance, I think it would help us quite a lot. Thank you.
Yeah. So I think International Lab Branch, you just need to come up with either a criteria to say, for you to qualify for technical assistance, we want X and Y, and I'm sure you will have a lot of requests.
Okay.
Just be ready to serve. Almost every country faces these challenges and would benefit from technical assistance. Otherwise, thank you very much. We are well above our usual time. We may not continue the discussion on the session, but the discussion should go on the WhatsApp. Let the questions continue flowing and provide the answers. The subject matter experts will be providing the answers. Continue to share your experience. If you have any practical solutions, continue to share. I also remind you that our traditional LabCoP session is coming on the 24th. We are going to share something very, very interesting about optimizing laboratory networks for efficiency and cost effectiveness. And then we have a very resourceful subject matter expert to handle this. So I encourage all of us to be on the call on the 24th of this month. Otherwise, we shall be giving you updates of our next waste management training. And thanks to our trainers and subject matter experts from the International Lab Branch for advancing this. Thank you very much. Have a nice morning, evening, and afternoon. Bye.
Thank you.
Thank you, Charles. Thank you, everyone.
Bye.
Thank you, everyone. Okay. So good. Yes, yeah, go ahead.